Let's talk about preparations, because there are some preparation criteria for zirconia that's important. Once again, if you're using the ZirCAD, the Ivoclar's zirconia, there's going to be a couple guidelines. Remember, the different zirconias with their different strengths have minimal requirements as far as reduction. And this is going to be the preparation guidelines for the MT and the MT multi full contour. So once again, this is the more aesthetic, has more yttrium stabilized molar percentage. So this is going to be the 4 molar percentage. And the monolithic anteriors, the incisal and occlusal reduction of the tooth structure, at least 0.8 of a millimeter. Reduction on the labial and lingual in the cervical area by at least 0.8. So if you're using the MT or the multi for full contour, 0.8 of a millimeter is really all you need. And you see in the little circle in the middle the type of margin that you need. Is basically a chamfer margin. And then monolithic posteriors, you basically need a millimeter. If you can remember a millimeter, then you're going to be fine. The big thing that I think a lot of people will make a mistake on, I'm going to highlight my cursor here, is this area. So 1 millimeter in the central fossa area. So if you're prepping straight across, you're probably going to have a very thin spot in the central fossa area. So just make sure that when you're prepping anatomically. If you're using the LT full contour, then this is going to show you for the anterior, you can go as thin as 0.4 of a millimeter. And that's quite thin. And then the posterior as thin as 0.6. Once again, you're looking at a chamfer margin. If you're using the MO or LT, the frameworks, we're looking at, this is for cutback. We want to at least 1.4, I usually say 1.5 millimeters on the incisal edge and the lingual concavity areas, and about 1 millimeter at the cervical areas. And once again, this would be like bridge abutment frameworks. You're going to see the same on the posterior, 1.6 at the occluding surfaces, and then around the cervical areas, we're looking at least 1 millimeter. So this is the typical prep that we would consider conventional crown preps, and this is appropriate for zirconia. Zirconia, you can really prep a lot of different ways. I think that like any other restoration, having a little more reduction is not going to hurt you. If you're trying to be conservative, you also have the options to be strong and still be very conservative. Most of the crown preps that we see, taking old crowns off, you're going to have a preparation very similar to what you're seeing here, which is fine for zirconia. This is another preparation on lower bicuspid. The reduction is appropriate. Probably could use a little more anatomical reduction in the center of this area, even though I think you have at least 2 to 3 millimeters of clearance here. The margin is also something that you'll need to think about with zirconia. Even the more translucent zirconias, you're going to see the margin if you get some recession. The crown beside this is a lithium disilicate crown, and you'll see that the blend of the ceramic will be a little bit better than the blend of zirconia at the margin.